Well, welcome everyone tonight. My name is Cindy Huber. This is the Living Donors Together program, and this year in 2019, our illustrious co-chairs of our group, who you'll meet in just a few moments, came up with this theme, and I think it's an appropriate theme as we really focus. And tonight you're going to hear from a couple of people sharing their stories, and they're real people, and they're going to say their real stories. But the reason we're focusing on that is I think to first of all celebrate those stories, to honor donors, to honor the role and the gifts that transplantation gives to many people, but also to reinforce the need for the 1,500 people tonight that are still waiting for kidneys in Wisconsin. So of all the organs, over 1,800 people are waiting in Wisconsin. 1,500 of those people need kidneys. So our work in promoting awareness of living kidney donation is vital. So will be our agenda tonight, and so I'll be turning it over to one of our co-chairs. But as you can see tonight, we'll hear from real people. We'll have a chance to ask questions about their experiences. We'll be able to share our own real stories, questions. We'll turn it over to Sarah, who's an awesome person and a volunteer member of our advocacy committee. And then we'll have plenty of time for questions. There I am. So we're thankful to Emma, our intern, who stepped in and put this PowerPoint together, and I guess she thought you were all wondering what I looked like, and so that's why this slide is next. But I do think what's important about what is on my slide is that what people might not know is that the National Kidney Foundation, since its inception, and here in Wisconsin we started in 1968, is, if you look at the last two lines, our commitment is not just to individuals in terms of kidney patients, but our organization has always been committed to increasing the availability of all organs. So I'm honored that you've all joined us. I'm especially thankful for the folks that have joined us tonight. And Jill, I think it's over to you.
Excellent, thank you. Welcome. That picture that you're seeing right now is myself and Dottie the donor dot, who many of you probably have met, and Sarah. Sarah is actually my kidney recipient, not the Sarah that's on the call, but a different Sarah. And we are actually coming up on our 8-year kidneyversary here on July 21st of this year. We had our surgery at the University of Wisconsin Hospital, and both of us are actually doing fantastic. So we are very, very grateful for everything that has occurred since our surgery. And she and I actually run a nonprofit organization together called Central Wisconsin Gift of Life. And so that is a picture from 2 years ago from one of our scavenger hunts that we do every year. So that's my recipient, Sarah. But tonight I want to introduce you to Lenny and Emily, who is his donor. I actually was able to meet Lenny online, I guess, after seeing his story, and I was just really honestly very inspired by his story, and luckily they're going to tell it to you tonight. But I was very inspired by how one t-shirt that was worn, or several t-shirts I guess he'll tell you about, that were worn to a Milwaukee Brewers game, were able to just really change his life and change Emily's life. And so luckily we were able to get them tonight, and I want to turn it over to Lenny and to Emily to share their story with you. So welcome, both of you. Thank you for joining us tonight.
Thank you so much. I'll go ahead and start. Thank you everyone for listening. We definitely appreciate it, and thanks for the opportunity to get my story out, to get Emily's story out. that will hopefully inspire others to do the same. I'm Lenny Zwig. I'm a 45-year-old father of 3. I used to travel quite a bit for work in Africa specifically, and while there on a business trip, I contracted something called dengue fever, which is mosquito-borne encephalitis that causes a whole gambit of health conditions. What it did is it sped up my immune system, so it was not taking care of just the bad things that were going on in my system. It was also fighting off my own organs. In the process, it damaged my kidneys to the point where they couldn't come back. That was in 2004, and they were going to list me back then, and decided not to because I was kind of on just the verge of renal disease. Over the years, my functionality went down to the point where I started dialysis in 2015. I was listed in 2015. Initially, there was some interest. I had a family member who was tested and went through the process to be a donor share program through the National Kidney Foundation. It fell through. I also had a close call with a high school friend, that lived out of state. That went all the way to the end. Another close call. We almost got there. So there was quite a bit of ups and downs in the search process. After that second close call, spirits were at an all-time low in the Zwig household. But we decided that we needed to do something. So my wife designed a T-shirt with a share your spare message on the front with a smiling kidney, and then my information, father of 3, my blood type, a phone number that we had put on there to take and receive calls, and our Facebook page. Started wearing them. Friends and family bought some. It was pretty cool. My son then, knowing that I've been going through a rough time, still working full time, still at dialysis 3 times a week. He bought good seats to a Brewers game. It was the second home opener that season, and the third baseline, 5 rows up, off the dugout, pretty primo seats. We got there, and before the game, we were trying to take selfies, and a nice gentleman took pictures for us. And then through the course of the game, a young gal behind me, saw my beard at first, and then saw the message on the back of my shirt, took a picture of it, posted it to Instagram. The next morning, reposted it to Facebook, and it immediately went viral. Everything just blew up from getting, maybe 1 or 2 messages a week. Now we were getting, hundreds of messages a day. The response was overwhelming. It was, I became emotional over it, knowing that there's that many people that are willing to help, or, at least to show their support. A lot of people got tested, and they kept narrowing it down, best match. And that's when Emily came in. She was getting tested a long time before I even knew about it. I didn't know who Emily was until the 2 weeks before surgery, when they said that they had a date. So, we met for the first time at the hospital on some of our pre-op.
Yes. So I guess I'll jump in and kind of explain my part until the official meeting of Lenny and I. But for me, what happened was I just kind of was going through some things in life where I knew I needed kind of a change. And ultimately, I wanted to help somebody else. I wanted to look outward instead of inward. So I made a bucket list in November of 2017. And one thing on that bucket list was just to help out a complete stranger. And at the time, I really had no idea what that was going to look like. And I certainly did not think it would lead me to donating a kidney. But that was just one of my really big goals and something that I was really hoping to accomplish in that year. So now it's 2018, and I had just taken a trip out to Colorado with one of my really good friends. And before I left, there was just something in me that was telling me I should donate a kidney, but I had never heard of anybody who needed a kidney or really had no idea about the entire process. So I did a little bit of research. So right before we had gone out to Colorado, I had told my friend, I was like, I think this might sound crazy, but I think I need to donate my kidney to somebody. And she was like, well, to who? And I'm like, I don't know. I think I need to. And I told a couple family members, and they kind of thought I was crazy. So when I returned from the trip, it was just a few days later, I logged onto Facebook for the very first time. And the very first story that came up on my news feed was of this man, which I now know is Lenny, who was at that Brewer game he was talking about with that shirt on. And something in me just told me, you need to help this guy. Like, this is the sign that you've been waiting for. You were thinking about donating a kidney, and here it is. And I told Lenny this, that he reminded me a lot of my dad. Having a dad and two other siblings, I just really was struck by his story and knew that I needed to help him. So I reached out to them initially just saying I was going to get tested, but I had not really told them anything more than that. So I don't think I was on the radar at all. So I got tested, and that took a couple months until finally in October is when they had told me that I would be donating on Lenny's behalf to help him out. So that's when Lenny and I first officially met.
Yeah, I had posted that we had, I got the call while I was at work, and I'm working in an office environment, in a manufacturing plant. And for some reason I had left the ringer on my phone. I usually mute it, automatically when I get into the office. I was walking to get coffee, and I heard my phone ring really loudly. So I ran back to my desk to grab it, and I saw it was the clinic. So I answered the phone, and it was Jeff, the transplant coordinator. And I said, hey, Jeff, how are you doing? And he goes, well, what are you doing November 2nd? And I said, well, I don't have any plans. And he goes, okay, then you're getting a kidney that day. And I, said something inappropriate and loud, which I think I got a pass on. But then started to freak out, and he was giving me, the details. People from work were coming up and hugging me and crying, and it was quite an ordeal. So that night we went home and wrote a poster board that we could post online, with the surgery date on it, and did kind of a public thank you to whomever was responsible for this, not knowing it was Emily at the time. And she responded to the post, and the rest is history. Her family is my family, and vice versa. We're in contact quite a bit, and we stay pretty close.
Absolutely. And I'll never forget that day either, because so initially when I had gone through all my testing, I knew I wanted to help Lenny. And so I'd gotten a call. So my kidney coordinator was actually the same one as Lenny. And he had told me that my kidney was too small for Lenny, but he had asked if I wanted to continue with the process. So I did. And it wasn't until one of my final stages, because you go through multiple different appointments and stages, that he was like, well, if you connect with him into the National Kidney Registry as a pair, that could help him even more. So he asked if I wanted to do that. And I was like, well, absolutely. So after all of that and going through like the evaluation and the CAT scan and all of the other stuff, and I was officially approved to donate, it took almost 2 weeks, if not even that, for them to finally call and say, hey, what are you doing on November 2nd? And I was at school when I received the phone call. And I remember being like, well, I'm teaching because I think it's a Friday. And they're like, no, you're donating a kidney that day. So it was pretty exciting. And I knew that I was helping Lenny, but at that time, like he said, he still had no idea about me. So when I saw his post, I knew I had to reach out. And as he said, his family is now my family. And it could not have worked out any better. I truly think God had a hand in all of this because it's been amazing.
Yeah, it certainly has. You know, I lost my mother almost a year to the day of when I had my transplant, and I'm certain that she had talked to somebody to get something done for me. So you know, I always take some comfort in that, and I hope she knows that, you know, everything turned out all right. And you know, after the surgery was set, we had the big surgery, and that was quite an ordeal. You know, Emily popped out, you know, the day after. She was bouncing around just like Emily does. You know, it took me. I was in for a week before I was released for home, and then it was, you know, probably about a 6 or 7 week period before I really started. You know, initially after the surgery, I could tell things were different. I could tell that my brain was working better. My color was better. I could start tasting a little bit of the food that I was eating. So I noticed all that right away. But as time went on, the first 6 weeks into recovery, then I started taking huge strides forward, you know, surpassing anything that I had done the year before or the years before, as far as, you know, my energy levels, my, I slept better, the food tastes better. You know, you don't believe people when they tell you you're gonna feel so much better. You almost forget what that feels like. But yeah, I feel great now, and it's all, you know, thanks to Emily, Chuck, and Michael, our other two of the Fantastic Four that are in Pittsburgh. You know, Emily couldn't directly donate, so, you know, agreeing to be put into the National Kidney Registry nationwide definitely, you know, improved the chances. It was 2 weeks, 10 days maybe, you know, before we got a solid hit and a surgery date. When I was on the registry before, it was a full calendar year before I started to see any kind of, you know, anything moving. So this was, it was awesome. I mean, it was hard, and don't get me wrong, it's not easy, but the outcome is amazing.
Yeah, and so after surgery, so like while you're going through the process, and knowing that I was going to be a pair with Lenny, they don't tell you like who's going to be receiving your kidney or who Lenny was going to be getting his kidney from. It's kind of, you just don't know. So right after surgery, I had written a letter because all I had known is that it was a male in Pittsburgh, or in Pennsylvania. I didn't even know Pittsburgh at the time. So I had given that to my kidney coordinator, who took that letter and mailed it out to my recipient. And I would say not even maybe 5 days, not even that. After surgery, I'd gotten a phone call back from my recipient, whose name is Charles Davis, from Pittsburgh. And he gave me a phone call, and it was quite life-changing too, just an extremely emotional conversation between the two of us. And since then,
what was the first thing he said to you, Emily, when you talked to him?
So I answered the phone, and I was actually at school when I wasn't supposed to be, because I was supposed to be on rest, but I had to go have lunch with one of my kids. And so I saw that it was from Pittsburgh, or from Pennsylvania is what my phone said. So I answered it, and all he said was, "Is this Emily Nowak?" And he had a really strong accent. And I was like, "Yes." And then we both just started crying. So it was pretty emotional, and just, I will never forget that day. Just quite a great feeling. And then I remember after getting on the phone, I was like, "Oh my gosh, I can't wait to tell Lenny that I know his donor too." And it was incredible, and they were able to communicate right away. So the four of us, we talk quite a bit, and we're hoping to get together, all four of us, soon. So it's been quite a journey.
Yeah, it has, and one of the results of this wonderful wave of goodwill was that we were also invited to throw out the first pitch at the Brewers game this year, almost a year to the day to when my shirt went viral initially. And we were, I'd have to say, both Aurora and Brewers were treated us very well. We got to get down on the field, we got to meet players, we got to meet former players, we got some autographs. It was, I felt like a 7-year-old again. It was quite an experience. Everybody asked, did you hear the crowd when you were walking out to the field? And no, I really didn't. I was kind of focused on, what we were supposed to do. But everything went fine. We had lots of friends and family there to support us, and it was just an amazing experience. Something that it's difficult to explain.
Yeah, I would definitely agree with all of that. And I remember when Lenny asked, he said, "So are you prepared to throw out a first pitch at a Brewer game?" And I thought, no, I don't have quite the technique down that Lenny did, but it was still quite an incredible experience. And I couldn't be more thankful to Aurora and the Milwaukee Brewers and everyone else. See, we have a question. It says, "Is there any significance in the jersey numbers?" So for me, that's a really great question. I chose number 4 because that was a number that seemed to appear very frequently throughout the entire kidney process. So the first day that I saw the post was on April 4th. And then my very first kidney test was on May 4th. The day that I got the call for donating my kidney was on October 4th. And then the day that I got released from the hospital was on November 4th. So I was hoping the actual kidney donation would be on 4 too, but I got released on the 4th. So, and then to top it all off, there are 4 of us in our kidney chain. So the 4 really stuck with me.
And for me, I used the number to commemorate the date, April 7th, that we were able to do this. So, I don't think I'd forget about it, but yeah, it was just an amazing experience.
Yeah, I got it tattooed, so I guess I can't really forget about it anymore. Not that I would, but.
Well, this is Jill. Thank you. Boy, you guys, okay, I'm crying. I'm glad you guys can't see me because I'm over here crying. But, Emily, your story, it's funny because it so mimics mine. I knew something was about to change in my life before I was what I believe asked to donate a kidney, and I believe God was involved in mine too. But it's so amazing how much I think I hear from a lot of donors that they just feel this calling or this need to do something outside of themselves. And I love how you said that you wanted to look outward instead of inward, because I think that's imagine what the world would be like if everybody did that, if everybody looked outward instead of inward. And so, I just thank you for stepping up and being Lenny's, ultimate donor, donating in honor of him. And you can see it from that side. Lenny can see it from the recipient side. I know both sides are different, and I just, you know, thank you and welcome to what I consider to be the greatest club on earth. It's a wonderful feeling, and again, we just thank you, and thank you guys for sharing your story. So I guess right now I wanted to ask if there's anybody on the call that either wants to unmute themselves and jump in, or wants to just type a question that you have for Lenny or for Emily, or any comments at all on their story.
And I also, too, just wanted to jump in quick, Jill, and say thank you for that. Lenny and I are both part of an organization called Donor to Donor. And talking to them, I hear a lot of the exact same things you mentioned, with how they just feel like it's a calling and their purpose to help others out. So it's a wonderful organization that helps spread awareness for people that are looking for kidneys, and for us to be able to share our stories and do that advocacy work. So I just wanted to kind of give a shout out to Donor to Donor. Yes,
and definitely some very smart people that you know, are definitely making some changes in how people use social media to broadcast their stories, to gain momentum. You know, it's just amazing. You know, statistics like it's, you know, 50,000 views before you get one response is the typical, you know, return, you know, from, you know, a post asking, you know, and then the dynamics of how you ask the question, it will get a better response if you do it this way, if you don't do it this way. So, I mean, they're really thinking, you know, grassroots thinking on how to accelerate the experience as quickly as they can using, you know, social media as a background. So it's interesting stuff. It really is.
This is Michelle. I will jump in with a question. Emily, again, from Living Donor to Living Donor. Tell us how you're feeling, and do you have any, how is your recovery, and do you have any restrictions right now?
Hi, Michelle. Thanks for the question, and you know, thank you for being a donor as well. That's wonderful. I've been feeling really great. So as I kind of mentioned, I was in the hospital for about 2 days. Shortly after my surgery, about 5 days after surgery, I hopped on a plane to Pennsylvania, not to see my recipient because I didn't know at the time, but I had a conference that I needed to attend for school. So that was 5 days, and then about 2 weeks after surgery, I flew out to Ireland and was fine for all of that. So my recovery process for me was pretty speedy. And since then, I haven't had too many hiccups. I just had my 6-month appointment last month, and they were a little concerned with my hydration levels and some protein things. So I'm trying to keep those in check. But other than that, I've been very healthy, staying very active. I'm pretty big into running and hiking and things like that. So I did a half marathon 6 months after surgery, and I'm hoping to continue on with that. So for my recovery, it was very smooth. And I don't know if it's that way for everybody, but from my own experience, I can say that it went very well.
Well, that is wonderful to hear. I'm so happy you had such a great experience.
Thank you.
I walked a 10K like 6 months after mine. So there you go, girl.
There you go. Good for you.
I was just going to comment and ask Emily to stop making the rest of us look bad. If you
gosh.
I was going to say, Emily, this is Cindy. We're going to like edit out just that little part about the 5-day thing. Yeah,
although she's a lot younger than us. She's a lot younger. So
yes.
We'll give her that. Yeah.
I was like, yeah, I don't.
It's definitely a lot different after donation, though. I will say that. Like, your body just needs a little more time to recover.
I have a question, but I don't want to cut anybody off. This is Cindy, and this is kind of for Lenny. A little bit, can you talk a little bit more about many individuals that we encounter. We do community education programs just for the general public, you know, on living donation. We work with each of the transplant centers throughout the state. But many times folks that are on dialysis, you know, they might learn about living donation, but they feel like, I can't ask my friend, I can't do that. I mean, did you have any hesitations or second thoughts about just even when you went beyond your family, if that makes sense? Did you have any, because I think a lot of times people, that's part of the biggest barrier is just you gotta not be shy when you need a kidney. Can you talk a little bit about that and maybe, did you ever feel that way or hesitate before you kind of went public, if that makes sense?
Yeah, that was definitely, you know, I'm not, as far as social media is concerned, I'm not a very, you know, open individual. And it was a difficult transition for me. To make that leap into the public eye, if you will, knowing that, you know, you're fully exposing yourself, and, you know, that there was a little bit of a hang up with that. But once it got going, you know, that feeling diminishes. You know, as far as asking people, it's more of an indirect ask on social media, so it makes it a little bit easier than having a conversation with someone face to face. You know, and there was people that would come right up and talk to me about it. There was also people that would avoid me because they didn't want to talk about it. You know, so you get the mix of it. You know, I wouldn't walk up to people and ask them what their blood type was or anything like that.
How many kidneys do you have?
Yeah, you have pretty good health. Can you say, you know, none of that. But, you know, if they asked how I was doing, then I'd try and work in the conversation, you know, just, you know, it's a long wait for a deceased donor. And, you know, it got easier and easier the worse I felt to be able to do it. And it was just because, you know, it was, you know, dialysis there's a lot of ups and downs with dialysis, and you feel, you know, crappy, you know, 75 to 95% of the time. So it's difficult to go through that kind of situation, and not want to get out of it, want to claw your way out of it. Somehow. So that's once we had the shirts made, I accepted it and went with it, and we worked very, very hard. That was one of the things I wanted to say to everybody, is that it didn't just fall in our lap. It was something that we had to work for and plan for, and you know, really work at. Hats off to my wife for picking up all the slack. You know, when I was down and out and helping out with this, it's very important to have a team around you that can help support your mission.
So the other question, again, I don't want to interrupt anybody, but until I see either Jill or Michelle telling me, Emily, and then maybe Lenny to you, one of our efforts here is to also educate employers, because as you know, employers that employ under 50 people are not obligated to give people any time off for living donation. So one of the things the National Kidney Foundation of Wisconsin is doing is we're creating educational tools that, again, dialysis patients or active volunteers we're trying to really focus on small to medium-sized businesses to educate them also. Emily, can you talk a little bit about the support as it related to your work environment, co-workers, or even the reaction of your employer, and if you're comfortable with that, and Lenny maybe the same, if you're comfortable with that.
Yes, absolutely. So for me, actually, I did not tell a lot of people that I was doing this until very close to my donation. So especially my employer, because kind of like you said, I didn't really know how they would respond, and I wasn't sure how it worked with like days off. So I didn't want to tell anybody until I absolutely had to. And actually, I work at a school, I'm a teacher. So for my school district, a law just got passed, I want to say a year ago, maybe a little before that, I would be able to use my FMLA, so like my family medical leave, for this type of instance, which prior to that, I don't believe that I would have been able to. So it did work out well into my favor. But when I did finally tell my administration and my staff and even my students, everybody really supported me just 110%. Especially like my staff. I mean, I couldn't say enough amazing things. They all got Donate Life shirts, and they had a huge assembly in the gym with the students, and really talked about kidney donation and just donation in general. And I think it was extremely important for the students to be able to see just how other people, can benefit from small acts of kindness. And that's really what I was hoping to instill in my students. But yeah, as a whole district and as my school was concerned, they were awesome. They were all behind me. There was no trouble with, getting off or leave days. They even had mentioned like some of them were going to donate me their sick time if they weren't going to let me off. So yeah, they were great.
And Lenny, how about you?
Well, I kept it, management knew that I had issues, I definitely, because of dialysis and timeout and things like that. They knew, but most of the people, most of my peers that I work with, I kept it from them. Not until closer to, go time, because I started putting up flyers around the office about my Facebook page, Lenny's Way to Meet the Kidney. And then posting things about selling the shirts, and then posting things, at work about the Brewers game and things like that. Everybody was very supportive, especially in the HR department. They went above and beyond, trying to make sure that my disability was in order, and I was going to be taken care of when I was out. So they also made the accommodations for me to be able to work from my dialysis chair, work from home, to accommodate, the way I felt in the schedule. So, I'll be forever grateful for that.
Now, is your employer above 50 employees or under 50?
Oh, yeah, it's above 50.
Okay.
Yes, we're more around the 1,700 employee range.
So really a barrier that we've heard from some of the transplant centers is people might be medically cleared. We heard that, I think, after our last Living Donors Together program, informally, when we were talking here with our clinical expert from one of the transplant centers. But of the 5 people like Emily who were medically cleared, 2 were saying no, that they couldn't go through with giving the kidney because they worked for smaller organizations, and there was just no policy, and there was no ability for that employer to understand that maybe there were different ways, to accommodate that person. And so we really feel that that's a niche. That to me really struck home, that shouldn't be a barrier, that maybe with education and presenting a variety of ideas, if you will, employees donating time, et cetera, that kind of thing. So
Yeah,
that's kind of a real niche we feel in Wisconsin, because the majority of businesses in our state are small to medium-sized businesses.
Mm-hmm.
So anyway, so hopefully you'll join that effort, or help us spread the word.
Yeah,
We
most
spoke to people when
Absolutely.
we get that toolkit ready to go. We're hoping the whole Living Donors Together group will, quite frankly, and I think that's one of our underlying goals, is by kind of meeting together like this, that we're kind of just in our minds educating ourselves about different aspects and things, et cetera, beyond our own story. So thank you both very much.
Yes, so Emily, Lenny, do you have any final thoughts? Anything else you'd like to share with our living donor friends who have joined us this evening?
I guess mine would be, you know, if you're in the situation, if you're looking for a donor, you know, definitely if you're doing it via social media, it's much easier to ask somebody to share your post than it is to ask somebody to give them your kidney. So please, you know, keep that in mind. You know, when you're getting that message out there, work your message in, but definitely keep it public friendly, because not everybody knows what creatinine levels are or GFR stands for. You have to do a lot of education of other people yourself, but keep at it. Don't give up. You know, even if you're thinking that it's not gonna happen for you, it still can. You know, I'm living proof. I feel great. You know, I want to give back now. I'm back to the way I used to be. So, you know, check out my Facebook page, Lenny's Way Needs a Kidney. Post questions, whatever you want. Let us know. We'll reach out. We'll help you, guide you through the process of finding a donor.
Wonderful. Well, we invite Lenny and Emily to both join Living Donors Together at Wisconsin. I know we share stuff from your page and follow, so
I'm in.
Excellent.
Absolutely. I'm in too.
Excellent.
And I believe we're recording tonight, right, Michelle? We're recording tonight, so this will be on the National Kidney Foundation of Wisconsin's page, so we can share this on our Facebook page as well. And so I think there's a lot of great, you know, we can share this webinar with everybody on our Facebook pages and wherever, because I think there's just really a lot to be learned from their story, for sure.
Thank you so much for having us. We love being able to share our story and hopefully inspire some other people out there, you know, to do good or to help somebody in need, or just to keep on trying, because there are people out there that are willing to help. So
that's great. Oh, and I'd like to mention that I only got to throw out the first pitch at our college wood bat league here in town. I didn't get to do the Brewers.
Oh, wow. Maybe we can put in a good word for you.
Oh, I appreciate it.
You have to grow a 2-foot beard to do it. Yeah.
I'll work on that.
So now we'll be turning our program over in terms of some other things you can do in terms of your own personal advocacy. Obviously, I think letting other people know about these groups. But we have an awesome volunteer who is joining us tonight also, and is a part of this group as a liaison from, I'm very proud that she's also volunteering for the National Kidney Foundation of Wisconsin on our advocacy committee, as we try to change not only impacting education in our state, but we're trying to create some national change too, aren't we, Sarah? So I'll turn it over to you.
We are trying to do that. Can you hear me okay?
Yep, Sarah, we can hear you.
Great, thank you. Greetings from the La Crosse area. As Cindy mentioned, I am the NKF Wisconsin Advocacy Liaison. I received a kidney transplant from a living donor on August 29th, 2018. And like Lenny, my story is a bit unusual because the woman who donated on my behalf is someone I don't know. She learned about living kidney donation at a Super Bowl party where an acquaintance was sharing his story of living donation. And she decided that that might be something she would be able to do. And luckily for me, she knows a coworker of my sister's, which is how she came to donate on my behalf. So we have a little bit of a sports connection, and certainly got a kidney from somebody you'd never known before connection. And just a reminder to all of you that are living donors to share your stories. You could inspire someone else to donate. If you want to go to the next slide. I want to talk tonight quite a bit about the Living Donor Protection Act, which is a bill that is currently in Congress, and there are two main parts to the bill. The first prohibits insurance companies from both denial of coverage and increases in premiums for life insurance, disability insurance, and long-term care insurance. And then secondly, it also clarifies that organ donation surgery is a qualifying serious health condition under the Family Medical Leave Act. So Emily's experience was that she did get those FMLA protections through her employer, but not everyone has to offer that right now. Some states have a version of Living Donor Protection Act. Wisconsin is not yet one of them. But because it is not your own health condition that's causing you to have the surgery, and it may not be an immediate family member, you don't always get those FMLA protections. So Living Donor Protection Act would take care of that. There's another minor part of the act that mandates that the Department of Health and Human Services update educational materials to include the benefits of live organ donation and the impact of live donation on access to insurance for donors. I'm very passionate about this bill because of the challenges I had finding a living donor. Like Lenny, you know, I have a genetic disease, so it's a little bit different than Lenny, and 2 of my 3 siblings are affected by the same disease. I happen to be the youngest, so it was a little bit challenging to find a family member. And then I had quite a few friends, including at least 2 potential donors who tried but had to drop out because of concerns over continued employment. And the Living Donor Protection Act would really help with some of that as well. So these bills were introduced simultaneously in both chambers of Congress, the Senate and the House of Representatives, on February 14th. Currently, the House bill has a total of 62 co-sponsors out of 435 members, and the Senate bill has 10 co-sponsors out of 100 members. And what's the importance of co-sponsors? More co-sponsors generally means more attention to the bill and may possibly increase the chance of the bill being passed into law. And ideally, we want to develop influencers or champions that are really passionate members that can, in addition to co-sponsoring the bill, contact the referral committees, help line up witnesses for committee hearings, and urge leadership to bring the bill to the floor for a vote. Champions can be persuaded by stories from constituents affected by the bill, or if they happen to have a personal connection to the issue. And we currently have, as shown on this slide, 3 co-sponsors in the House. Unfortunately, none of them are on committees to which the bill was referred, and I'll get to that in a moment, but they can still be influencers or champions. These 3 co-sponsors happen to be the 3 Democratic representatives from Wisconsin, but this is really a bipartisan bill, and party lines shouldn't be an issue. It's also a bill that is considered budget neutral, meaning it doesn't impact or involve spending federal dollars, which is often important to members, especially Republicans, who tend to be budget watchdogs. Any member of either chamber can co-sponsor a bill, which basically means that they support the bill and would like to see it passed. So do you want to go to the next slide? Neither one of our senators has co-sponsored the Senate bill at this time. It has been referred to the Committee on Finance, and neither of our senators are on this committee, but that doesn't mean they can't co-sponsor or become influencers or champions. And then the House bill has been referred to 5 different committees. 2 of those committees don't have any Wisconsin representatives. Those are Energy and Commerce and House Administration, but we do have representatives on the other 3 committees. Glenn Grothman is on both the Oversight and Reform and the Education and Labor committees, and both Brian Stile and Sean Duffy are on Financial Services. Committee members can become influencers if they're moved to support the bill. Here's a little bit more about each one of those important committee members. Glenn Grothman is from Campbellsport and represents East Central Wisconsin. So counties include Columbia, Marquette, Waushara, Green Lake, Fond du Lac, Manitowoc, Sheboygan, Ozaukee, most of Winnebago, and the northern half of Dodge County. Sean Duffy is from Wausau and represents most of northern Wisconsin, particularly the northwest part of Wisconsin, so excluding the greater Green Bay and Door County areas. And then Brian Stile is from Janesville and represents the far southeastern corner of Wisconsin, from the Beloit-Janesville area to Racine-Kenosha, and his district also includes parts of Milwaukee and Waukesha counties such as Oak Creek, Franklin, Hales Corners, Muskego, McWanago, Big Bend, Eagle, North Prairie, Wales, and Genesee Depot. You can tell I grew up in Wisconsin because I can pronounce all these names. If we can open up the phones briefly, we'd like to know if anyone on the call has a personal connection to either of our senators, or if you live in the districts of or have a connection to any of the representatives that have not yet co-sponsored this important bill. And if you don't want to talk, you can also type it in a comment or a question. Contacts from constituents, especially those with a connection to the senator or representative, are the most helpful. I'm just pausing to see if anyone's going to comment or type in a comment.
This is the kind of thing, though, on social media. You see what I mean? So even though you don't. So Sarah, would you, we're looking for people then ultimately, and you'll probably highlight shortly what kind of the next steps could be to reach out to people and how easy it is with the NKF tools.
Yep, you bet. So if you want to go to the next slide. For either the Living Donor Protection Act or any legislation related to kidney issues, or others if you're politically active, you can do all of the things listed here on the slide. You know, write letters, connect on social media, call their offices. If you're not sure which district you live in, you can go to house.gov and enter your zip code. And depending on where you live, you might need to enter zip +4. So you might want to have that handy just in case. Or go to senate.gov and choose your state. And this will provide you with the names and a link to the websites for your senators and representatives. Their websites include their mailing address and phone numbers for both their DC offices and for their local offices. And they often have more than one. So they might have 3 offices within their district. The senators certainly do, and many of the representatives have at least 2 offices. So if you call, all you have to do is provide your name and address to let them know that you are a constituent, and ask for their support of, it's easiest to use the bill numbers, so HR 1224 or S511 for Living Donor Protection Act. If you write, make sure you mention those bill numbers. And most of these folks are on Facebook, Twitter, and Instagram. So again, on their websites in the Contact Us section, they will often have their handles, or so that you can follow them, and then tag them on your posts. And we've got a specific suggestion coming up on that. There's also coming up fairly soon is the August recess, which means that all of these folks will be in their home states for the entire month of August and into September, so covering Labor Day weekend. And they will be active going to events, they'll have meetings in their offices, and they may also hold town hall meetings that you can sign up to go to. And those are all great ways to communicate with and get to know your representatives. And even if you don't meet them specifically, then meet with their healthcare advocate in their office, or healthcare, staff person. So even if you can't get FaceTime right with them, it's important to get the message to their staff. And then let's see, do I need the next slide or not? I forgot. Can you peek at the next slide for me? Oh, no, not yet. So National Kidney Foundation, on their website, which is kidney.org, they have a menu at the top where you can select the Kidney Advocacy Committee, and that's where you can access the current National Kidney Foundation legislative priorities, and can even apply to become a Kidney Advocacy Committee member. This area of the website is a great resource for things like printouts that can be provided in a face-to-face meeting that give quick details about, an overview of the Living Donor Protection Act, or statistics about kidney disease in the state of Wisconsin and why this is an important issue. It's a great resource for those things as well. And now if you want to go back to the next slide. There's also a new bill that was recently introduced called the Chronic Kidney Disease Improvement in Research and Treatment Act. It's only in the Senate so far. You may want to mention this to your representatives and Senate, well, not to your reps, but your senators as well. It was just introduced May 23rd, 2019. You can see the two senators that introduced it. You'll see almost every bill is introduced by both a Democrat and a Republican. It's just a great way to show that it's a bipartisan bill. And this bill has four main parts. The first is to increase awareness, expand preventive services, and improve care coordination, including care coordination for dialysis patients. The second is to incentivize innovation for drugs, biologicals, devices, and other technologies. Next is to improve the accuracy and transparency of end-stage renal disease quality programs, which would include adding 5-star ratings for dialysis centers. So you may or may not be aware that your hospitals and also insurance companies that offer Medicare replacement plans have a 5-star rating. So they're rated between 1 and 5 stars, 5 stars being the highest quality. And they're going to, this bill would also require that rating for dialysis centers. And the last part of the bill is empowering patients, which would add access to Medigap coverage. Medigap plans are supplemental plans that cover remaining costs after Medicare payments. So if you're not aware, Medicare, particularly Part B, does not cover 100% of the amount they approve for a service, so you have usually a 20% copay. And if you don't have other primary or secondary insurance, a Medigap policy can help cover that remaining amount after Medicare pays. And then the NKF is also working on a bill that they hope will be introduced in September, just after the August recess, that would be for coverage of immunosuppressive medications for transplant recipients. And this coverage would last their lifetime instead of the current 36 months following transplant. So just for example, I'm 57 years old and my transplant was in 2018. So I'm only covered until I'm 60 years old. And then that coverage will end. Now, I right now have good primary insurance, but these transplant medications
Yeah. Sarah, we're not able to hear you. Don't know.
Oh.
There you go.
Okay, can you hear me now?
I can hear you now.
Okay, good. So again, this immunosuppressant bill would cover lifetime instead of just 36 months, and that's really important for recipients. And just on a personal note, since this is my birthday month, Medicare took the time to send me an email to wish me a happy birthday. I thought that was really sweet. If you want to go to the next slide.
Well, happy birthday to you, Sarah.
Well, it's coming up in a couple of days here, but I was like, really, Medicare? You don't have better things to do than send me a happy birthday email? But, you know, great. So we had a great experience at the Derby Dash. This was our first advocacy table event, and I felt it was quite successful. We had a game to draw people in, and while they were playing the game, I was able to engage with them. I usually asked what their connection was to the event. Why did they choose to come to the Derby Dash? Many were kidney patients, either transplant recipients or dialysis patients. Quite a few were healthcare workers. And one lovely couple said that they just like the walk because it's stroller friendly and they can bring their kids, which I still loved. And then I discussed the Living Donor Protection Act with them. Most of the attendees live in Gwen Moore's district, and she's one of the representatives who have already co-sponsored the bill. So we focused on contacting our two senators, and while many said they were willing, it's hard to tell if they followed up or not. I mean, you know, life happens. And as enthusiastic as people are at the event, after they drive home, they may forget about that important step. At our next event, which will be the Capital City 5K in Madison, we will have some sort of action item, either a postcard or a letter or something else they can complete and we can collect so that we know how many contacts are made. And we can imagine delivering a packet of postcards or letters to Tammy Baldwin or Ron Johnson's office in support of Living Donor Protection Act. And we also plan on encouraging social media posts, and this is what I was talking about earlier with a specific example. So we're hoping people will tweet something like, I'm at the NKF Wisconsin Capital City 5K at Tammy Baldwin, please support Senate 511, the Living Donor Protection Act. You know, it doesn't have to be worded exactly that way, but something to let them know that you're at an event and that you want them to support these important bills. And that's it for the advocacy update.
Excellent. Thank you so very much, Sarah, for that update and opportunities for all of us that are part of this group to get involved, to spread the word, and continue to educate and advocate. So thank you so very much. That was in depth and very informative. I'm going to ask if anyone else has any final questions for Sarah and or Lenny and Emily. Because we are at a minute to time. So go ahead and unmute yourself or type a question in the chat while I'm giving just a few more closing remarks here. Again, I'm Michelle Sherman. I'm one of the co-chairs of Living Donors Together Wisconsin. We are so grateful and thankful for the National Kidney Foundation for partnering, for being the leader in creating this social support network for living donors. Without them, we would not have the capabilities, the depth, and the ability to reach people across our great state. So Cindy Huber, to you and your fabulous team that are all here with us tonight, at the National Kidney Foundation office on behalf of living donors, and I'm sure all the recipients out there, we say thank you.
Thank you.
As we look to next steps and ways to get involved, again, Living Donors Together was created by donors for donors, a place that we can advocate, empower, communicate, network, gather, etc. So we encourage everyone to spread the word, share our Facebook link, attend the webinars, tell your friends and family about how you're involved in this transplant space. And again, if you're not a member of the Living Donors Together Facebook group, we encourage you to be a part of it. Join us. We're 128 members strong, and the last time we connected, we just reached the 100 mark. So we are excited to continue to connect folks.
And recipients can join too, Lenny.
Okay.
So
No
we let anybody that is willing to tell the story and the importance of living donations. We want your voice.
There are caregivers and transplant coordinators that are a part of the group, recipients, etc. So exactly, it's a great place to connect and celebrate living donation. Upcoming events, want to give a shout out for Capital City 5K. That event is coming up on Saturday, July 27th. If you have not registered, we encourage you to. There will be a Living Donors Together Wisconsin team, so please look for that when you are registering. And there'll also be a table the night of the day of the event. So we are looking for volunteers to help man that table, if you will. So if you have some extra time that day and would like to connect with living donors, please reach out either through the Facebook group or contact Cindy Huber at the National Kidney Foundation and let them know you'd like to volunteer to be a part of the Living Donors Together efforts that day. Jill and I had a table there last year, and it was so great to connect with living donors and to put the faces to the names and be able to tell stories and really celebrate living donation. There's more ways to get involved. Join a team, fundraise, continue to fundraise if you're not able to attend the event, and then volunteer.
And I'll just interrupt and just point out that Elise Bardsack, who is a nurse at Children's Hospital and an anonymous living donor, is leading anyone that's running and walking, so for the Living Donors team. So you can find the Living Donors team by either going to our website, the Kidney Foundation of Wisconsin, and then you can just join that team right there or form your own team. There's also a list of volunteers, so if you want to do a water station or if you want to help with registration. Sarah, I know you have another living donor joining you already at the table, correct?
Yes, and she may be bringing her recipient as well.
And she's just new to our state, so we're just glad that she's joining us there.
So we are hopeful that there's a large representation of living donors and friends and family and others that are a part of this effort. So anything that we can do to promote awareness, whether it be the Living Donor Facebook page or our other social media sites, we encourage everyone to get involved. And again, if you can't attend, please consider a donation. And for me this year, I'm unable to attend as it's the 5th anniversary of my living donation and kidney transplant. So I'll be spending the evening with my recipient. All right, mark your calendars. We want you guys to join us for the final 2 remaining webinars for this year, Wednesday, September 18th and Wednesday, November 20th, again, 6 to 7 p.m. Same format with the webinar series. Registration for those open 1 month before the webinar, and you can always access those from the Kidney Foundation website. And another shout out and plug, stay connected, join the Facebook group, create your own private Facebook group or join others, post and share stories from what you're reading in the community to our Living Donor page. We definitely want that interactivity and stories being shared from across our membership. Like I said, we're pulling stuff from Lenny's story to be able, from your page, to be able to share with our group. So it's just a great community, very positive, supportive group of people. Again, we're recording this webinar this evening, so if you want to share this with others or tell others to check it out, you'll be able to access that from the Kidney Foundation website. There we are back at the beginning. Any final questions or comments as we wrap up tonight's program?
This is Jill. Just wanted to say thank you to everybody for coming. We appreciate it.
Yeah, and thank you to Jill and Michelle, who are the inspiration, and to Sarah. Thank you, Emily and Lenny, for joining us this evening. Thanks to all of you that were a part of this evening. And we look forward to learning more and eliminating the waiting list here in Wisconsin.
Yeah.
So thank you all.
Absolutely. Thank you, everybody. We appreciate it.
Good night.
Good night.
Good night.
Bye.